Thank you very much, Claudia. And first of all, nice to be online and live. And so what the best thing or the way to celebrate the day as discussing how can we make their world more friendly to periods. So let me tell a couple of words about this interesting conference that changed the perception and change the world. ICPD stands for International Conference on Population and Development, and it was held 30 years ago in 1994 in Cairo. Back then, 179 governments adopted a groundbreaking program of action focusing on women's reproductive health and rights. Today, and this year, 2024, this marks a 30th anniversary of ICPD, and this is a year and this is a momentum when the global community, including UNFPA, is reflecting on progress, achievements, and setbacks on sexual reproductive health and rights. And why ICPD is so important. Why we're talking about that so much. It was indeed a revolutionary document. And why? Because it marks the important shift from the demographic discussions on population size and concerns about overpopulation of the world to the recognition of the basic rights of all couples and all individuals to decide freely and responsibly the number, spacing, and timing of children. Over to you, Claudia.
Thank you very much for the enlightenment. My participants who have joined would now what the ICPD is. But then you share with us the progress so far and the setbacks that have been observed since then.
Yes, indeed. We have seen significant progress since 1994, and we are very happy about that. Between 2000 and 2020, maternal mortality declined by 34%, what is excellent. From 1990 to 2021, the number of women using modern contraceptives doubled. And birth among girls between 15 and 19 years have fallen by almost thirds, what is as well a very good progress. And so far, at the moment, 162 countries have passed laws against domestic violence. Progress is happening indeed, as I said, but it is happening too slow. Inequalities are widening, human is still being politicized, the rights of women, girls, and gender diverse people are facing a quarter of women cannot refuse sex with their husbands or their partners, and nearly 1 in 10 women have no choice over whether to use contraceptives. So if we want today and by 2030 to meet sustainable development goals, we must support our commitments made 30 years ago with sufficient funding and system reform. And we need to ensure the rights and choices for furthest behind. And of course, when I'm saying that, I mean women in countries with fragile settings, women of African descent, indigenous women and young people with disabilities, and so far. So that will be about the progress and setbacks, Claudia.
Thank you very much, Elena, for the insight. Indeed, we've seen a lot of progress, but at the same time, much unfinished business, especially when it comes to contraceptive use and sexual activity, especially when it has to do with persons with disability in society. So thank you very much.
I think your voice is breaking a bit. Can you come closer? Because like it's very breaking.
Am I clear now?
Can you talk a little bit? Maybe
Is it better?
yeah, now it's a bit better because it was so breaking before. Yeah.
Right. So I was just commenting a bit on Elena's feedback. So I was saying that I believe that this calls for an urgent response from all governments. And I think it's important to see renewed commitments and urgent action from governments in order to advance the ICPD agenda. Right. So, Dina, over to you. In your opinion, how do you think we can ensure meaningful youth participation in the implementation of the ICPD program of action going forward?
Thank you so much, Claudia. Happy Menstrual Hygiene Day for everybody today, for all women all over the world. But like, yeah, go back to the question about ensuring meaningful youth participation in the implementation of ICPD. I think there are a lot of things that we still need to do. But then at least at the moment, I am creating a little bit like what is it, suggestion that require multifaceted approach for all institutional, social, and policy level intervention. So like at least what I was thinking is like there are 7 steps that maybe many also organization that watch today can also follow up this. First, of course, it's important to have institutional mechanism for youth involvement, because sometimes yes, people want to involve youth, but it's very in the level of tokenistic way. So that's why it's important to also maybe think about creating the youth advisory boards to also take their voice into account, starting from the beginning, the implementation, and then even until the monitoring and evaluation at the end, so that we do not only include youth in the middle of the program, but like since the beginning, since you were thinking about that. Also, it's important to have the capacity building and empowerment. In Yield Hub, we have the topic around how to ensure that young people are not aging out rather than aging up. Because like sometimes after you become youth, you already like 30 above, and then like some organization will be like goodbye, find your own way to reach and climb in this a serious world, and then like professional world. Not that, like we want also, and we need the capacity building and empowerment in each institutional that they really want to involve young people. And then I think it's also important to have the third one is inclusive policy development. um, Again, this is about consultative process that you have to also include young people in your mind starting from the beginning, and then also take their experiences and also perspective into account. And then there is also, it's important to have youth-led policy recommendation. Yes, there are a lot of important position like highly level panel of eminent person have the recommendation, government have recommendation, but how about the young people? They need to also have the youth-led policy recommendation that maybe for them this is how it's supposed to be done, rather than just like not listening to them. The fourth is it's important to have the collaboration and partnership. It's really I think that that's also like the essential, the core like the core thing that everyone should do nowadays, rather than fighting and then not like literally collaborate. The fifth, like it's monitoring and accountability. It's important as well that the young people is there, and then also we hold each other's accountable. It's not only that young people looking at the government or so, or institutional, but also institutional can do that back to the young people. This is what you said, and then we're following this, so how about you? So something like that, it's important. And it's important also to have visibility and recognition, that after all the young people have done, also they need some the recognition, so that like at the end they can feel that they own this program, they own these strategies together. And then the last one, above all of that, it's going to be useless if we do not address barriers to participation, because sometimes the participation for young people is very limited. Even if there is a participation access, it's only occurring in a certain level of young people. Not all young people, even the people that live in the remote places, can have that access. So I think those 7 implemented strategies needs to be done, and we have to do it all together. So yeah, I hope it helps you.
Thank you so much, Dina. Even as a youth advocate, I did not really know all these steps you mentioned, and I think that we've been talking in circles around this particular topic, and we've not really paid much attention to some of them. So thank you so much for the points. I've noted them down. Okay, great. So I think we'll now move on to Elena to tell us what UNFPA has been doing together with the European Union to advance sexual and reproductive health and rights. Elena.
Yes, Claudia, very happy to share. Indeed, in general, UNFPA works closely on these issues around our 150 offices, and very often those programs are supported or implemented jointly with the European Union. So I will give you one example, very recent one and very relevant in my view. UNFPA collaborates with European Union, with regional partners, and with EU member states at the moment to improve sexual and reproductive health and rights in Africa, and especially in sub-Saharan Africa. So there we focus on maternal health, especially addressing such an issue like postpartum hemorrhage, PPH, which is a major cause of maternal deaths in Africa right now. We have around 20 million euro support from European Union, and we created jointly a Team Europe initiative, which is called Safe Birth Africa. And this initiative aims to provide life-saving medicine to prevent maternal death. This particular program will be focusing and working in Côte d'Ivoire, Madagascar, Nigeria, Uganda, and Zambia. And then we hope to expand that, and we will be strengthening national capacity in those countries, especially for midwives. And we will expand tools and treatments for management of postpartum hemorrhage according to WHO guidances. And of course, the entire aim of this program is to reduce maternal death during childbirth across Africa. Over.
Thank you very much, Elena. These are actually really interesting programs that the UNFPA is doing. I think even in Ghana, UNFPA is doing a lot when it comes to women's sexual and reproductive health and rights, especially in the area of maternal mortality and addressing gender-based violence. And they have many implementing partners and people they work with to make sure that some of these social issues are addressed. So thank you very much for letting us know what UNFPA is doing from your end. Thank you very much. Great. So as a youth advocate myself, I believe that sometimes working with, not sometimes, but actually working with young people, because usually the target group usually has to do with young people, women and girls, and then marginalized groups in society. And so I believe that continuous partnership, seeing young people as equal partners, and like Dina mentioned, working with young people right from the onset and not just involving them in the middle of the work somewhere around implementation, but like from the designing stage to throughout the whole implementation stage. It's actually a good thing that would help us to realize our dreams together. All right, thank you very much. Great, but I would also want to know from Elena how I know for Ghana's end how UNFPA is engaging young people. From your end, could you just tell us a bit of what UNFPA at your end is doing with young people in this regard?
Yeah, you are absolutely right, both Claudia and Dina. I think it's so important that you reiterate how important it is to decide on youth issues with youth. And I think, you as young advocates should remind us all the time, but kind of like be assured that UNFPA is keeping youth in the core and in our hearts, because of course, these young people are the core of the UNFPA mission. Today, we have 1.8 billion adolescents and youth worldwide. Can you imagine? I mean, out of 8 billion. It's a huge, huge group and very important one. And despite some progress, many young people still, especially girls, lack the supports they need to reach their full potential. And this is, of course, I mean, we have to address, and we are very, very much concerned about. UNFPA believe that investing in young people benefits everyone and is shared responsibility. So we truly believe that families, community leaders, NGOs, governments, business, all play a role. What we do in our country offices and globally. So first of all, of course, for UNFPA, it's very important to promote comprehensive sexuality education, in whether it be in school, out of schools. I mean, we believe that providing information, knowledge for young people is critical, as you both said. Of course, improving sexual and reproductive health services, including HIV prevention and care, is very, very important. UNFP is well working a lot with young people directly. So we have, and maybe you might met these groups in your countries. We support the Y Peer network. So it's a network of young people around the world who share information on sexual and reproductive health and rights with their peers. So they teach, they share information, and this is really appreciated, I think, by young people. And as well, as I mentioned, this year we celebrate ICPD 30 anniversary. And of course, we could not have done that without young people. So we brought earlier this year around 200 youth organizations and leaders globally to assess progress and plan for the future with young people. So this is just some examples of what UNFPA is doing. Claudia, over to you.
Thank you so much, Elena. I'm glad I'm hearing this from your end as well. Great. So, team, I think that when I began with the presentation, I mentioned that we'll be tackling about 3 topics. So I think it's now time to shift gears and talk about menstrual health, which we are celebrating today. So I think the first question around this will be to Dina. Dina, why do you think menstrual health is important, and what do you think are the consequences of lack of access to menstrual products?
Yeah. Thank you, Claudia. I mean, why it's important is very clear. It's like, I think it's easy to answer. It's a basic human right. Many people still do not have that access. I mean, I'm coming from Indonesia, even though like at the moment I'm living in the Netherlands, it's something like also a bit different to be more open to talk about sexual reproductive health rights in the Netherlands, or like talking about the menstrual health and access to the menstrual product. Because like, I remember back then when I was still teenager. I mean, I'm 28 now. When I was like around 13, 14, 15, like when I was trying to be like the leader of like the organization in my school, and then people clearly just saying, oh no, you are women, at the end of the day you are girls, will be having a menstruation and it will affect your standard and quality to be a leader, because you are not gonna decide everything or like lead everything using your own mind. You're just gonna be like using your heart and then your feeling. So that's really really annoying for me, because they just like put women that have like menstruation will be like the secondary human being, that they cannot actually be a leader as well. This also affect, if I'm seeing like in another part of Indonesia, that they don't have access to the menstrual product or menstrual pad, and it's expensive in Indonesia to get that. Let's talk about like, for example, in East Nusa Tenggara, many young girls cannot go to the school because basically they don't have access to that. It's expensive, and when they have menstruation happening and then people see the blood, and then they will mock, they will bully, and they're like, oh, you're bleeding, yeah, yada yada yada. And then like, of course, as a girl, they will feel like under pressure, and then like, okay, I'm not gonna go to school because there are a lot of boys gonna like mock me. And what it affects and leads to, that the dropout rate in a lot of places are very high for girls, and then at the end of the day it's likely that girls will be only having a child marriage or teenage pregnancy as well, because this clearly very taboo. We do not talk about it. Sometimes when many girls like me, for example, when I discuss this with the parents or like the father will be like, oh, no, 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 search this on internet, or like ask your mom. And then when we ask the mother will be like, oh my god, I'm so busy taking care of the household already. So we do not have places to go. We do not have the right person to discuss about this. So that's also the reason why I created Sexdugram. It's a online platform on Instagram to discuss about comprehensive premarital sexuality education. One of them is actually menstrual health, because sometimes like there are a lot of misinformation, myths like, oh, during your period you shouldn't wash your hair. Why? Because you're supposed to be like perceiving your own what is it, the healthiness, because the moment like you wash you are gonna get sick. And how? It's 7 days and you didn't wash your hair. It means that like your hair will be like very, very sticky. But that has been taught since we were kids. And before that, there is no Google for when I was like 10, at least. Like, I don't know where to go. Like, I don't know how to ask. Sometimes the misinformation being spread out by the teacher as well. I remember that the teacher telling, do not wash your hair during your period or menstruation, because it's not good. You are gonna get sick, you are gonna get fat. And I was like, how? But of course that discussion is not happening, and you cannot discuss with your peers either way, because like we are in the same level. So you know what I mean, like just because of the menstrual health education, and if it's not happening, there are a lot of things also affected by that. And eventually, what Ellen already said, that yeah, it will happen at the end of the day. There are no participation, for example. If it's like for the girls, it's only for like the boys, let's say. And then like us as the youth advocate or activists trying to ensure this is balanced, but from the core we didn't tackle that, it's also gonna be a problem. So if you wanna, I still remember like when I do the problem 3, we do not tackle the problem, like the core problem. We only like tackle from the middle. But like seeing that, oh, actually it's happening since we were kids. Or like when we ask parents also bring some of the problem towards these issues as well, or even like the society. And I believe that also in Ghana this thing is still taboo, or not, Claudia?
Yes, yes.
How about
In
that?
Ghana, it's I think we face similar challenges over here as well, and especially because we are quote unquote a religious country. There are certain things that you cannot really discuss with certain people. So it's more of not really a safe space to really talk about certain things, including menstrual health. And I think one way that we as youth advocates tackle it in Ghana here is to, I mean, it's a basic human right, but in Ghana, when you talk about human rights, it's usually as though you are imposing certain Western Western beliefs, and so we tackle it from the point of view of public health. That way, people are more open to really understand the issues, to embrace the solutions or the remedies that we suggest. So we look at it from a public health perspective. Um, and we also do a lot of education so that we can, change perceptions and mindsets and misconceptions that people have around the topic. Um, so Dina, I just want to follow up with what you said. Do you think that education is important? Like education on menstrual health is important, and why do you think so? What do you think it can change? How do you think it can help? Yeah.
Really, I mean, I just want to emphasize again, like it's very important. Again, like I think I've mentioned about, if we tackle this kind of issue, we try to resolve from the core. We're gonna have a fully participation of like between girls and boys at the end of the day. The education rate, the dropout rate will be like decreased at least, and then the access is equal for both sides. And also, you know, sometimes we also have a lot of cultural and social resistance, that it's cultural norms and belief that actually this is not healthy and whatever, or like the community resistant and telling you shouldn't use menstrual pad, just like let it be. For example, if it's in the area that doesn't have access to clean water, and then they force you to just use the pads, that the reusable one, you cannot clean that. It will create another STI, or like another like problem with your organ, and then like, you know, it's so bad. So that's why like the education regarding the types of, let's say, menstrual pad and everything regarding to menstruation, it's important. Yes, in Jakarta it's good because we have access to clean water, we have more choices, we want to use any type of like product for menstruation. But sometimes, like in Nusa Tenggara, that you have to walk for 10 kilometers just to get the access for clean water, that doesn't make sense. Even if we want to tackle like climate change issue, it's just not in the right place. So I think it's also important to see the area, see also the norm there. How can you also penetrate to the society so that there will be no resistance from the religious leaders or even the leaders in the ground. So yeah.
Right. Thank you very much. I think that Elena should have a voice on the topic as well. We want to know how UNFPA is working to eliminate period poverty.
Yes, first of all, Claudia, Dina, it's amazing to hear your examples, and I mean, it makes it so much closer to reality, right? I mean, so we are not theoretical here. It's indeed, I mean, one thing that you mentioned already, and I just want to reiterate from UNFPA perspective, that we absolutely emphasize everywhere and always that menstrual health is a human right. It's not just a health issue, it's a human rights issue. And we truly believe that everyone has the right to bodily autonomy, which is a part of it, of course. And you said it all in principle. I mean, it's really, the reality is very sobering. I mean, you mentioned some examples, Dina, like how in the countries, I mean, the menstruation is taboo. And it is indeed, I mean, it is taboo. It's leading to exclusion from daily activities due to stigma, shame, and discrimination. Women in some countries are not seen as clean. I saw some comments from our audience making these examples that some women cannot even cook for their husbands. I mean, probably it's a good thing, I mean, not to cook for a while, but I mean, kind of like, this is a joke, of course. I mean, this is just showing that women are not considered to be clean. So, and think just to bring as well that the idea of that no setting is less period friendly than a humanitarian setting. So we are talking about how many problems in calm countries are, but let's take a humanitarian crisis. I mean, this is a disaster at all. UNFPA, of course, have a lot of initiatives to eliminate period poverty, and they are innovative as well, and so we try to see what fits in which country. Just to give you some examples, so of course it's a distribution of dignity kits very often, and especially in the humanitarian settings, because this is an overlooked issue very often. And humanitarian settings, women are still menstruating, so we share dignity kits with some simple and very essential things like soap, supplies, underwear for women and girls. In Gambia, for example, we help to produce recyclable sanitary products, and we distribute them for free in schools. In the Dominican Republic, it's a very interesting initiative that UNFPA is doing. It is very much linked with what you, Dina, I think, do. I mean, talk about sexual spreading sexual and reproductive health information, but this is in Dominican Republic, they conduct intergenerational conversations to generate dialogue between moms, sisters,
Important.
aunts, grandmothers, and adolescents. So, I mean,
Exactly.
I think it's a very interesting thing, kind of sharing their experience, including on menstruation. In Moldova and Burkina Faso, they have an innovative program. They launched the IMI Watch, and this is the first battery-powered digital watch to track menstrual cycle without an app. So, I mean, you can use it even if you don't have internet, for example. And I will conclude with another example. UNFPA partner with fashion industry, for example. And there are a lot of top models who participated in the campaign, Let's Talk About Periods, talking about that or addressing these issues. And this is a part of our cooperation on the period tracking Flow Up, which is a period tracking application which at the moment cover around 10 million users. So that's a little bit what we do.
That's a
Thank you
lot.
very much, Ellen. Yeah, thank you. I think that was extensive. About the digital watch to track the menstrual cycle, I think I may have to take it up with the UNFPA Ghana office to see if I can get one if they have one available. Thank you so
Sure.
much.
We'll be happy to
Thank
help.
you so much. Yeah, thank you so much for your contributions. I think time is fast spent. We would have loved to take questions from the viewers. Unfortunately, we are far beyond time, and so um, I'm sure that probably when people have questions, they can always, DM us. You can DM the PPAG profile or Countdown Europe or even the hub if you have questions directed at any of us. So thank you very much. I think that I'll just add a few minutes of my own words. Right. So with regards to women and girls' access to health, including sexual and reproductive health and rights, I think that an intersectional approach is very important. Multi-sectoral approach is also important. We cannot do the work alone as individuals or as individual organizations. I think that we need to capitalize on the partnerships or the collaborations we have with other organizations so that, it's more effort is put into the work so that we can address some of these societal issues. I also think that meaningful youth engagement or participation, as Dina mentioned, should not necessarily be a way to, tokenize young people to make young people feel as though, okay, we are occupying the space because it is required, or you have a percentage to fill. 25% young people are supposed to be in a particular meeting, and so no, I think that we really should meaningfully engage young people right from the conceptualization of programs to the design of projects, all the steps that has to do with program management or project management. Young people should be in all these processes. And I also think that the partnership between the EU or Europe and then developing countries like Ghana should continue, and the funding should also continue because we really lack some funds to be able to really address the issues. So we would say that thank you UNFPA, and thank you for the cooperation and the funding you've been helping us with as well. And for dinner, I think that after this meeting, I would still like to engage you more on the youth participation, meaningful youth participation. And I'm sure the viewers will also want to reach out to you as well. So thank you very much. I think that we can take one question, just one question from a follower. I think any of you can address this, but let's see the question and see who can take it. It reads, how do we ensure the safety of data when it comes to the period watch? I think this is directed at Elena. Yes, how do we ensure the safety of data when it comes to the period watch?
Yeah, absolutely. It's an excellent question. I noted it as well. It is indeed, because I mean, when we're talking about periods, I mean, we're talking about a lot of innovative solutions, be it this EMA watch or be it a period tracking applications. And the issue of data protection is, of course, central. So for us at UNFPA, we, especially after COVID, we noted a lot how the world changed in terms of technology facilitated gender-based violence, or the issues that initially brings should bring good, but can be problematic in a way. So we, while working with, we work a lot with private sector at the moment as UNFPA, especially focusing on that as well, that if a period tracking application or watch is developed, that programmers and producers of the product should not only think how useful this product will be, but how safe that will be. We call it safe to be safe by design. So while designing the products, that have to be super thought through. So I mean, it's of course, I mean, we have a lot of well, various examples, right? But we believe in privacy of data and in safeness of these products. And of course, I mean, we're investing a lot when we work with researchers and with private sectors to address this issue. Thank you for that question.
Thank you very much. I'm sure that whoever asked the question is okay with the answer. So thank you very much. I think that's the limits of the number of questions you can take for now, as I mentioned, because of time. But hopefully you can reach out to us or DM us on Instagram as well. So this is where our chat for today ends. Please follow the Countdown 2030 Europe account on Instagram, the one from which Elena joined, and on Twitter as well, and use hashtag a world where to share your vision for the future where sexual and reproductive freedom are a reality, and continue to watch the space. Thank you so much to all our viewers. Thank you, panelists, Elena and Dina, and hope to see you soon.
Thank you,
Okay.
Claudia.
So
Thank you,
much,
Gina. Thank you,
Claudia and
audience.
Elena. Thank you,
Bye-bye.
everybody.
Have a great
Have a good day.
Bye.
day. Bye.